Bismillahirrahmanirrahim. Welcome guys. Now today we will discuss about the prehistory of preterm labor, pre-labor rupture of membrane or preterm pre-labor rupture of membrane. So this is the easiest most template. Let's discuss this. Initially you will always ask about the biodata. Then the presenting complaint, patient can come with any of the following complaints, which can be either low abdominal pain, abdominal tightenings, PV leaking, meconium stain liquor, or PV bleeding, per vaginal bleeding. Ask about the date of admission if admitted and the mode of admission. Then in the history of the presenting illness lies all the risk factors, differentials, and associated factors. You should inquire about the details of the pain and with the mnemonic of Socrates. S stands for the site of pain under the lower abdominal pain, abdominal tightening. If there is an upper abdominal pain, the cause may be any GI disturbance, any hypochondrial pain due to cholelithiasis, cholecystitis, or either due to preeclampsia. Then ask about the onset of the pain or PV leaking, is whether it's sudden or gradual. Its character of the pain, if it is spontaneous, rule out hyperstimulation and abruption. If it is intermittent, it can be labor pain. Then ask about the radiating nature of the pain, the relationship which will include all other differentials. So it includes different risk factors and relationships. If they are associated with urinary complaints, then rule out urinary tract infection and ask about the vaginal discharge to rule out vaginal infection. Then, if there is any relation with the food, inquire about and rule out gastritis, pancreatitis, and constipation. If there is associated cough and fever, rule out pneumonia and respiratory tract infection, which may be the risk factor for pre-prom. They ask and rule about polyhydramnios and multiple gestation, any history of trauma or fall, any coital history, cervical trauma history, or any surgeries, for instance, cervical colonization and cervical cerclage, any procedure done which can lead to preterm or pre-prom, including amniocentesis and external cephalic version, any previous history of antepartum hemorrhage, any infection which includes either pyelonephritis, appendicitis, or pneumonia, history of ops cholestasis, which can lead to preterm as well as meconium stained liquor, any history of uterine malformation, for instance, unicornate uterus can lead to preterm labor, any history of fibroids, although there is less evidence based upon cause the fibroid causing preterm labor, still it is one of the risk factors and you have to inquire about that. Any history of chronic vaginal leaking. Then inquire about the relieving factors, which can include either medication and position. In the aggravating factors, inquire about any association with the food, diarrhea, any position. Then if the patient comes with history of labor pain or either PV leaking or PV bleeding, inquire about associated factors to rule out your differential. If there is any pervaginal bleeding, inquire about the amount of blood, the color of the blood, whether fresh or old, red or brown, the number of clots, passage, any associated pain, and history of trauma or fall. So this can lead to our diagnosis of antepartum hemorrhage, labor pain, or any trauma. Inquire about pervaginal leaking. The details of that includes ask about the amount of leaking, the number of pads soaked, the color of the liquor to rule out meconium, any associated pain to rule out preterm or any labor pain, whether the leaking was spontaneous or after any work, any heavy work or any stress. Confirm the leaking always by asking whether her clothes became wet and whether she felt decrease in abdominal girth after the leaking. Inquire about fever to rule out podiumnitis. Inquire about the cord collapse. So this will lead to the diagnosis of either preterm pre-rupture labor of membrane, which is pre-prom, or prom, or podiumnitis. Inquire about the fever to rule out infections, as infection can also cause either preterm labor or PV leaking. Inquire about whether the fetal movements are satisfactory or not, any ultrasound done or not. Ask about the time duration of that pain or vaginal leaking or bleeding, then the severity of that particular problem. Domestic history has already been discussed in the previous videos. So if the patient is admitted, inquire about the treatment taken and effect of the treatment taken, the drug she has been using, the drug's name, and the side effects of the drugs. For instance, if the patient is taking any calcium channel blocker for the preterm labor, so it can cause the orthostatic hypotension. Ask about the steroid cover, which is must. Investigations done so far, which includes white blood cell count, C-reactive protein, ultrasound, and CTG. Ask the patient whether she has underwent daily choroamnitis monitoring, which includes fever, pulse, charting, and WBC count. The latest scan done and discuss the mode of delivery if the patient is at home. So this is the detail of the history of presenting illness. Let's quickly go through the rest of the history. In the obstetric history, inquire about any history of previous preterm because this is one of the risk factors for the preterm labor in the next and subsequent pregnancies. Inquire about any history of prom or pre-prom and history of cervical cyclage in the previous pregnancy. Short interpregnancy interval of less than 1 year is also a risk factor for the preterm labor in the next and successive pregnancy. In the gynae history, inquire about the cervical trauma history or any saponization of cervix. In the past history, ask about the connective tissue disorders to rule out cervical incompetence and cervical weakness that can lead to preterm pregnancy. In allergic history and in drug reaction, the family history includes any connective tissue disorder. Personal history includes the history of smoking and the low BMI, which can also causes the preterm labor. In the socioeconomic history, ask about the social deprivation. This is also one of the risk factors for the preterm labor and the preterm as well. So after checking the history, you can easily rule out following the differentials, which includes preterm labor, Braxton Hicks contractions, pre-labor rupture of membranes, preterm pre-labor rupture of membrane, placental abruption, urinary tract infection, any GI disturbance, preeclampsia, and any round ligament pain. So this is the easiest notes template by the help of which you can easily take the history of preterm or pre-prom or prom from the any pregnant woman. This is the history template. These are the differential. So you can take the major questions or any chance related to your particular level of your evidence or your case presentation and scenario. You can omit any details of the problem. For the more history templates, do subscribe our channel. Thank you and good luck.